The due date, you need to have all this stuff written in here, and when you pour it up, you're going to initial it. So this gets ready to go. So now we're ready. If we're missing anything. Okay, so what type of appliance are we going to be building for you? So let's say we're going to do an intro night guard. Okay. All right. So first step is make sure we have everything we need. We're going to put a bib on because impressions are messy. When you put a bib on a patient, we roll the top so this little edge doesn't hit into their neck. We don't grab it on the sides like that because it just folds the whole thing up. That's terrible, okay? Put it around their neck, clip it close to that fold there, close to that fold there. As the alligator clips are closer together, it doesn't choke them on their neck so much unless they've got kind of a thicker neck, okay? Make sure they have glasses. Do you know if you have any kind of a gag reflex? Okay, you can ask that. I'm going to fit these in. What I want to do is fit the uppers so that the teeth have about 5 millimeters of space on either side of the back teeth as I fit them in. Now, when I fit them in, I'm going to visually confirm. I'm going to visually confirm the fitting. If you don't have an overhead light, you need to be wearing an overhead light when you're taking impressions, okay? Most things for assistants that assistants are doing by themselves, you need an overhead light. Okay? Go and lean your head back for me against the headrest. I tell patients to lean their head back because it stabilizes the head. Otherwise, they're trying to use their neck muscles to stay in a single spot and not move back and forth. The chair headrest is generally too far back. If you do a little trick on your own where you sit in the chair and you move the headrest until it feels comfortable to lay back, generally your head is going to be it's going to be a few inches up off of the flat plane of where your back is. Okay, so generally I'm going to move this forward and I'm going to tilt it back a little bit so that it supports the back of the neck. And the headrest is generally be tilted this way a little bit and a little bit further forward than you would anticipate. It should not be flat. Flat is not comfortable. That makes the head fall back further. That's like you laying down on the ground without a pillow. Your head all the way down is not comfortable. You want to have a pillow underneath, and a pillow raises you up off of the plane. That's why we set that there. When we're taking impressions, we want it even just a little bit further forward because the more they're leaning back, the more stuff's going to feel like it's going to go back. Okay, for the upper one, I do want to lean them forward just a little bit. Now, when I am taking the impression, when I'm testing the impression, this is terrible. Okay, this is like trying to brush your kid's teeth like this. Not helpful. Okay, you should always be accessing the patient from over the top and kind of around the edge, or kind of to the side like this, but I'm always coming in with my hands around the sides. I'm never trying to come in from the front. Coming in from the front gives you terrible access of ergonomics with your hands. You don't have control over where you're putting things. So you're always gonna come in from the back, and as I come in from the back, open about halfway for me, okay? I'm gonna coach them and relax in their lips, okay? I slide the tray in, and that helps to retract the lip on this side, and then I'm gonna gently pull the lip on the other side to get the tray in. I'm going to check to see how much clearance I have, and I'm visually checking it as far as how far back it goes, and then is it gonna have enough space on the front? That looks good. I'm going to check the lower as well. Okay, same thing. Open a little bit bigger for me. Good. I'm going to check to make sure that it's not going to impinge or hurt the inside of the jaw there. Make sure that's not too big, and if it's too small, it's going to impinge on the outside, so you just need to be careful of that. And anytime that I'm placing this in, I'm manipulating the lips. I'm always telling them, reminding them to relax. Patients want to be helpful. They generally don't know how to be helpful. Patients generally are trying to open big. They're trying to open big, and when they open big, their orbicularis oris, which is the circular muscle that goes around the outsides of the lips, tenses up, and that pushes the alginate out of the way. It pushes things, it makes it so that it's hard to put the tray in because that muscle is tensed and it stops you from going. So you have to remind them, relax your lips, relax your jaw, and that'll give a little bit of flexibility and make it a little more clean. Okay, so I tried both of those in. Those are in good shape. You can use these the difference between these two, the perforation kind of holds the alginate in a little bit easier. These ones are really nice because these ones are important because they have what's called a rim lock. Okay, we try not to take alginates ever with the plastic ones unless it's just a sports guard. But if we're making something that's a little bit more higher definition, we want to have this little rim lock edge to it because it holds the alginate in place and gives less distortion to the model. Okay. When I'm mixing up, generally for an upper, I'll just do 3 scoops. And I like to mix without measurements. The measurements generally for me are too thin. They're too thin and soupy, and and it'll go down the back of the throat. I like it to be the consistency of peanut butter, okay? So it sticks, you can hold it, and it won't drip down at all. And the way that works is you just don't add too much all at once, okay? If you use cold water, it will set up slower than if you use hot water. Now this is kind of a slower or a regular set alginate. Okay, and as I put that in there, it doesn't look like there's a lot of water in there, but as I continue to mix, I can incorporate almost all of that powder in there, and it just continues to thicken up. Okay, I'm mixing around the edge just to incorporate it all in. Okay, and that consistency, barely a little bit of dripping. I could make it a little bit thicker, but that's going to mean it's going to not pass down the back of the throat as easily. So that's just, I don't want to make it any thinner than that. Okay, so I'm placing it in the tray. I don't need to goop a whole lot over there because the teeth are going to displace it. The last thing I can do is take a little bit on my finger there, and I'm going to mash it up on the biting surface of the teeth to take out some of the bubbles. All right, lean your head back against the headrest. And just relax your jaws for me. So I'm going to place this on the biting surfaces, take care of any voids. I'm visualizing, just relax your lips for me. And I'm going to look in the back, line it up on the back, slowly squish it forward. And watch what I do with the lip here. Relax the lips for me. I'm pulling the lips out of the way, making sure that it goes completely up into the vestibule, and then putting the lip over the top. Now I'm going to stabilize it. Just make sure it's fairly centered. I'm stabilizing without doing additional pushing. Okay? Now if we're border molding, we'll kind of pull the lip down like this. We'll use that for dentures. But at this point, I'm not doing it. One common mistake. The main common mistake what I see for these is you're not pulling the lip out of the way before seating the impression all the way down. Okay, that's the number one issue that I see. The lip's not out of the way because why? Because the lip's tight because they're trying to help you. They're trying to open big. You're trying to press it in, and instead of being in complete control, you're trying to push the lip out of the way with the alginate, and that never works. Okay, so we want to make sure that you've got lifting the lip completely out of the way before you're seating the tray. And I like to seat the tray from the back teeth forward so that it's not all gushing out the back. It wants to come more toward the front and out the sides, which is less gagalicious. Okay. The other more common mistake that I see not as often is people press it in place and they keep pressing and pressing and pressing and pressing. When it's starting to set up and you keep pressing, what happens when you have a sharp edged tooth that's sitting in the bottom of alginate is that it presses through and it creates a crack and it creates a split, and then you get a distortion that if I see that, I'll say, got to retake that, okay? If I don't see it, then I see it on the models, and then we got to retake it another day, which is not happy for anyone. Relaxing, this stuff sets up really well. Pink stuff sets up at a better pace for me. It's about a 1 minute setup. These are probably more of a 2 minute setup. Once you put the alginate in the mouth, the body temperature, which is 98.6 degrees-ish, is going to speed up the set of the material. So it'll actually be set, once it's set outside the mouth, it's definitely set up inside the mouth. Okay? Okay. If someone feels like, oh, they're kind of starting to gag or something like that, then I need to get into game mode of distracting them, because gagging is just they're thinking about a reflex. And so I'll say things like this. All right, Rihanna, I want you to put your hands out straight in front of you, straight out like you're a zombie. Okay, I want you to put your palms up. I want you to clench your right fist. I want you to stick your not your middle finger, your first finger out on the left side. Good. I want you to lift your left leg. Lift your left leg. I want you to put your right hand down on your right leg. I want you to lift your left arm up as high as it'll go. I want you to lift up your right leg. Okay, I want you to put your right leg down. I want you to put both hands on your lap. Good. So you can go through those cycles and just get them thinking about appendages, so they're not thinking about, okay, what's going on in my throat. The other thing is lean your chin down for me. Down, down. Go ahead and lean forward. Okay, doing that also takes pressure off the back of the throat, can make them a little bit more comfortable. However, the best way to not make sure that they're gagging is don't mix it up too thin so that it's not pouring out the back of the mouth. Don't put too much material in there. And those generally are the most helpful. What was that?
Don't go front to back.
Yeah. Okay. Now I want you to relax. So when I'm taking it out, the key to taking it out is I'm going to put my finger right at the back corner with her almost closed. Close down a little bit more for me, okay? And then I'm going to, as I'm torquing this, just gently torquing this way. There we go. Okay. Good. Okay. So we look at the impression now, and we're critiquing several things. Number one, did we capture all of the margins of all the teeth that we need to worry about? Okay. So we're looking at all these margins, checking all the way around. So I captured all the margins of all the teeth that we needed to. Okay. Then the soft tissue, did we get enough soft tissue? If it was a denture or a mouth guard, a sports mouth guard, we want as much of this as possible. We want to get up into the vestibule as much as possible. This is a little bit thin here, a little bit more went out the back. I think if it was a little bit thicker, I may have had a little easier time. So I would grade this probably a B+, because I could have had more material here, and I put a little bit too much off the back, which gave a little bit too much, her tongue had to hold some of that out. Okay, so I'm going to just get that wet, and I'm going to set that in the tray, and that's ready to go. Now, I take off my gloves and start over on this side, because I don't want to have to wipe any of this stuff down if I can avoid it. Actually, I forgot to clean out my stuff. So that, I put a little bit of moisture on there. One thing we can also do here is put a little bit of water on a paper towel, set that in there to keep it moist. It's not going to dry out in 5 or 10 minutes, but if it sits longer than about 30 minutes or so, you're going to get distortions from it drying out. Okay. All right, so I'm going to clean this guy out while it's still setting up. There should never be a time when you ever have a dirty bowl that's left unattended. That's a not my biggest pet peeve, but it is a pet peeve. If I see material sitting in a bowl, I mean, someone didn't take 30 seconds to clean up what they should have and was expecting someone else. It's like dirty dishes, right? So put it in the dishwasher. Okay. So that's ready to go for the next one. Okay. So I'm gonna take off my gloves so I don't have to worry about wiping this down. For the lowers, I'm gonna do 2 scoops. And if it's a really big person or a really small person, you can adjust that. Okay. So I'm gonna use a little bit warmer water if I can, but it does, warm water sets it up much, much faster. Again, just enough water to where it starts to incorporate. And you can tip over that edge really fast from just right to, okay, that's really, really kind of thin. So it's fairly thick, right? This one's a little bit thicker than the last one was. You want to incorporate it really well though. Should be smooth, and I'm smashing it, I'm swirling it. Okay, scoop it, and I'm smearing it down so it's a nice smooth texture. Should be very similar to peanut butter texture. Yikes.
Sorry.
Now this one's going to be similar in, I always stand behind the patient. It's similar in how full I fill this. But the tongue, I got to manage the tongue a little bit here. Okay. Put your head back against the headrest for me, please. Good. Open nice and big. Smear onto the teeth here. Capture across those front teeth there. Okay. As I place it in, relax your lips for me. Good. Put your tongue up on the roof of the mouth. Good. And I think it already started to set up. I think that hot water went really fast for me. Okay. Just relax down on that. Okay. So hot water makes it go just tons faster. I think
Looks kind of like the pink once it. Maybe even worse, actually.
Yeah, hot water.
That was quick.
Yeah, that goes really, really quick. So it's almost set up already. So if it starts to gel, or if it starts to solidify before you press it down. Now, temptation is to pull it out right then. It's not going to work. Avoid that temptation. Wait for it to set up so it's easier to clean up. Okay, it's kind of like mud on the carpet or something.
Yeah.
Wait for it to dry, and then start again. Okay, but it's the same thing. Placing it in, starting at the right cheek, flexing it out, placing it, visualizing before I lay it down. Right before I lay it down, I'm going to say, lift your tongue up to the roof of your mouth. Their tongue's going to come up out of the way. Then I'm going to press it down, pull the lips out of the way, and get the vestibule. But I noticed that was just starting to set up right as I put it down. So I'm going to look at this, and it's going to have some distortions there. It's not bad, but I can tell where there's some little pieces that didn't knit together correctly. So I can get a new tray, or I can just get this tray cleaned out. When's the time that you clean out a tray?
Yeah, after you're done using it.
As soon as you're done using it. Anyone that pulls stone out of a tray and doesn't clean out the alginate right away has not cleaned enough trays with dry alginate.
Right.
Okay.
Horrible.
Okay. So that doesn't take very long to clean those out when the alginate is still raw and wriggling. So So this time, if I do the exact same thing I did last time, expecting different results, that is called
Insanity.
insanity, right? It's saying, oh, I'm just going to do something. So I'm going to do something different this time, which is I'm going to do less hot water, do a little bit warmer. A little bit less warm is what I'm going to say. Just a little bit warmer. Okay. Too thick. And depending on the alginate, you've got anywhere from 30 seconds to about 2 minutes. If you're using the white stuff, which is a slow regular set, and use cold water, you got about 3 minutes until it sets up. If you use the pink and you use kind of room temperature water, it sets up in about a minute. If you use any of them with warm water, you never know. It could go quick on you.
Do you prefer whenever the other, the pink or the?
I like the pink. I'm just used to the time it sets up. Oh, you got your head back. That's the head back.
I think this must have been ordered, the regular was ordered by mistake.
All right, place it in. Don't lift your tongue up on the roof of the mouth. Good. And as I press it down, I'm pulling the lips out of the way. Put your tongue all the way forward for me. All the way forward, side to side. And relax. It's already starting to... Water is just too warm. So, note to self, don't use hot water.
Not
So,
even warm, just go with cold.
Yeah, that's
I find
what-
saliva is the perfect temperature for algae.
you know, that's one of the reasons I like the pink, is you use just like cool water with the pink and it sets up in about a minute, whereas
Right.
this, it's like, it takes forever, and then just a little bit of heat makes it just set up. It's just harder to titrate in the right speed when it's temperature based, because I can't exactly feel the temperature as well through my gloves as far as how warm it is.
We just want to see how much you can handle those, Brianna.
Yeah.
This is like a good volunteer. Okay. And
Get some Johnny Cash for this.
that's right. At least a nickel.
I got like the seasonal.
Okay, so I caught it right before it started to gel up. So I don't see any cracks or any raw spots. I got good molding of the vestibule there and there. The tongue is up and out of the way. I missed, well, there's, actually those look pretty good. So.
And you want more
overall-
definition, correct, when you're doing like either, of course, dentures or,
What do you mean by definition?
so you're looking more for the, like where the gums are gonna sit and, you know, margins are always important, but like if you're gonna do dentures, you want to have the upper gums, you know, especially, or the lower, you know, gums where they're gonna sit and where they're gonna meet.
So who's gonna be taking an alginate impression for a final denture? The
You.
doctor. The doctor should be taking the final impression for any kind of a final prosthesis.
Okay.
Should be taken by the doctor, right? So,
Yeah, we can.
for anything that is like a night guard or a mouth guard or a you know, EMAs, that kind of stuff. Those are different. A denture should be taken usually by the doc, unless there's just no other way to do it. Okay, so that's clean. I didn't leave it dirty. I got this a little bit wet, and now we're going to migrate to the lab. When you're